Hello, I'm Jo McDonough. I'm the Director of Strategy, and welcome to the launch of our new strategic plan. We did have a plan in place, but so much has happened in the last 18 months. It was really important for us to check if it was still the right plan for us. Living and working through a global pandemic has changed many things for us all. In early 2020, we also received our CQC rating of requires improvement. And this too meant that we've needed to reconsider our direction and priorities. So we've done that, and we've developed a refreshed short-term strategic plan which sets out our key ambitions from now until 2023. And it considers three key things. Firstly, why we do what we do. The Trust's vision, our vision, is leading the way with care, and we all come to work to provide the best care that we can for our patients and carers. So the next thing to think about is, if that's why we come to work, what do we need to do to deliver that vision? How can we lead the way with care? And this is done and described in our plan through our 4 strategic ambitions, and you'll hear in this video what those 4 ambitions are. And then the third area, why are we here? What do we need to do? The third is, how are we going to do it? And this relates to our values. How do we behave? How do we lead with compassion? How do we treat each other and our patients with kindness and respect? And these 3 things also outline the RDaSH way. So this video tells you how we will deliver our strategy together across the Trust.
Our first ambition is to provide safe and effective care, first time, every time, and we will do this by
providing good quality and safe care,
setting standards, training colleagues, and focusing on safety at all times.
Let's try and see if we can make sure that errors don't occur. But if they do occur, let's learn from them and put in place steps to stop them from happening again to somebody else.
Asking patients and carers to be involved in deciding what contributes to good quality care.
And to tell us if we are meeting standards.
Having sufficient colleagues delivering better care supported by a safety culture.
Encouraging colleagues to raise concerns about quality,
so we can work together to resolve them.
Ambition number 2 is to attract, recruit and nurture our diverse workforce so that we can give the best possible care to our patients. We will do this by
aiming to become an employer of choice, attracting and retaining a workforce that are proud to be part of the RDaSH team.
Looking after our colleagues' health and well-being because our people are important.
Continuing to recognise the importance and value of diversity and empower the voices of all to contribute to what it is we do and how we do it.
For patients, it means fewer staff changes and care delivered by staff who are trained in the most up-to-date clinical skills.
colleagues will have opportunities for development and a career pathway at RDaSH, and will feel valued and respected by each other.
Our third ambition is to improve timely access to services, which are inclusive and based on best practice. We will do this by
delivering effective and good quality services as quickly as possible.
Reducing the number of times a patient moves between services.
Building on the learning from the pandemic to continue to offer different ways that patients can access our service.
This includes face-to-face, groups, online clinics,
virtual appointments and via other digital technology.
We will also offer care at our hospital sites, close to patients' neighbourhoods and in their own homes.
It means patients will have shorter waiting times to access care and staff will be able to provide a more responsive service.
Our fourth ambition is to be a healthy organisation and partner through compassionate leadership, good financial planning, working with our communities, collaborating with our partners. We will do this by
aiming to improve leadership at all levels, with leaders being more visible and compassionate.
And by improving the flow of information from services and wards up to our board of directors and back, with the right decisions made at the right levels.
Keeping our finances on track and investing in our services.
We also need to make sure that we're keeping up with technology, enabling patients and carers to digitally engage with us if they wish to.
We're committed to working in partnership with others to achieve all of this, including our communities, patients and carers, the NHS, councils, the voluntary sector, and many, many more. We also think the RDaSH way is important, our way to improve quality and culture. Put simply, it's about how well we do what we do and the way we do it.
Did you think strategies were complex? Well, they're not. That's ours in a nutshell. If you've got any questions, don't hesitate to get in touch.